then we won't see ever again. He's already decided that. He's like, this is my last summer at home, and then I'm never coming back.
We have Murphy's Law press conferences here. We have a debate going on.
Yeah,
I'm sure
the vote's going to come.
Yeah.
So, so I'm going to go, and then I'm going to kick it to you, and then you kick it back to me. Then Dr. Faraci is going to speak. Then I'll close out. We'll do some Q&A for that. If the bell rings, he's going to have to leave. So I know you all don't want to hear me, so I'll be very brief and quick, and then get it directly to Representative Gattine, and then Dr. Faraci as well. I don't have cooties. You guys don't have to be way over the line. You can move up here.
Maybe you do.
Oh yeah, sure. Are we all set? You all good? All right, thanks. Hey everyone, thank you for being here today. My name is Toby McGrath. I am the State Director for Protect Our Care here in Maine. We're holding these events all over the country today on a National Day of Action for our Medicaid Awareness Month and the importance of it, and to highlight how Donald Trump and the Republicans in Congress are working to cut Medicaid by nearly $1 trillion to pay for tax breaks for the ultra wealthy. Medicaid plays a vital role in providing affordable health care coverage here in Maine to 340,000 Mainers. It is imperative that we have this health care system and stop having people break it. Now, I have the distinct pleasure of introducing Representative Drew Gattine, who is the House Chair on Appropriations and a strong advocate on health care. More importantly, he's on the front lines, along with Dr. Faraci, when it comes to the actual funding and how we get this done and what the effects occur when DC is not is threatening to dismantle our healthcare system, and when he has to put a budget together, along with his extensive background in healthcare. So, without further ado, Representative Gattine.
Thank you, Toby. Thanks, everybody, for joining us today. My name is Drew Gattine. I have the honor and the pleasure of representing people of Saco, Scarborough, and Westbrook in the Maine House. As Toby mentioned, I'm the House Chair of the Appropriations Committee. And outside of the legislature, I've spent the vast majority of my professional career working with states to protect Medicaid, making it work better for the people who rely on it to live their best lives. And I'm here today to deliver a simple message. Medicaid matters. Medicaid really matters. And right now, Medicaid is under attack. It's under attack by Donald Trump and by Republicans in the United States Congress. It's under attack by Republicans here in Maine, by Republican legislators who refuse to fund it in the current fiscal year and in the upcoming two-year budget. And in Congress right now, the only reason that it's under attack is so that Donald Trump and his Republican colleagues can fund tax cuts for the ultra-rich and to pad the profits of large corporations. Medicaid will be 60 years old on June 30th. And since its inception in 1965, Medicaid has been the primary source of health care for millions of Americans who would otherwise be uninsured and not have access to doctors or medicine or other life-saving services that they need to live their best possible lives. And this is true here in Maine as it is across the country, where MaineCare, Maine's version of Medicaid, supports the health of about 400,000 people. That's right, 1 in 3 people in Maine rely on MaineCare for their health care. Nearly half of Maine children are on MaineCare. Most Mainers who are in some form of long-term care, including nursing homes, rely on MaineCare. Adults with disabilities rely on MaineCare for the supports that they need to live independently in their communities and not in institutions. MaineCare is a principal source of funding for behavioral health care. No matter what you think about the program or whether or not you think it needs to be changed, the fact is that it is a central component of our healthcare system, and we can't allow it to be cut for any reason, let alone to fund tax cuts for billionaires. The consequences would be dire for the people who rely on it, and for the providers and businesses who rely on it, and for the workers who actually provide the care that people need. And this program is particularly important in rural Maine, where the greatest percentage of people rely on it. For example, over 40% of people in Washington County, Aroostook County, Somerset County are enrolled in Maine Care, and those numbers are similar in other rural counties in the state. If Republicans in D.C. get their way, millions will lose Medicaid coverage, and that will drive up costs for everyone. Ripping away health care from seniors and kids means the cost of uncompensated care will skyrocket, putting our hospitals further at risk. Approximately half of America's children have health care coverage through Medicaid. This number holds true in Maine also. Over 30 million children are enrolled in Medicaid across America. This represents nearly half of all the people who actually depend on Medicaid. Access to health care allows children to stay healthy and avoid health complications as they grow older. Increased access to Medicaid for children results in lower high school dropout rates, higher college enrollment and completion rates, and higher wages later in life. Republicans also talk about wanting to throw millions of Americans off of Medicaid by adding work requirements to the program. The fact is that work requirements only result in cutting people off from health care. Tens of millions of people would lose access to doctors and medicines, support they actually need to stay in the workforce. The fact is that most people who are enrolled in Medicaid who can work do work. And the few states that have tried to implement work requirements have been extremely unsuccessful, and it has cost more to implement than the actual money that it's purported to have saved. So let's stop attacking Medicaid. Let's make sure that children and older Americans and people with disabilities and working people have the opportunity to be as healthy as possible and stay in their communities and get the health care that they need to go to school and work and live their best lives. We need to send a strong message to Donald Trump and to Congress and to lawmakers here in Maine that the health of American people comes before tax cuts for the ultra-rich. Hands off Medicaid. Thank you very much. Toby?
Thank you, Representative Gattine. Now, Representative Gattine is on the front lines of policymaking here on healthcare, it comes down to it, but Dr. Faraci here is on the front lines with the patients that she provides care to and sees on a day-to-day basis. And she's here to discuss the importance in that human element of what Medicaid means to her patients and Mainers across the state. Doctor?
Thank you. Hi, thank you for the introduction. I'm Dr. Jessica Faraci. I practice here in Maine in the town of Brunswick, and in my practice, about a quarter of my patients are on Medicaid, or as we call it here in Maine, Maine Care. I cannot underestimate how devastating it would be to cut Maine Care. This is a vital service for so many patients. No matter what side of the aisle you're on, Republican, Democrat, blue or red, this is vital service that our patients would not be able to get without this coverage. I have hundreds of patients that would not be able to afford health care without Maine Care, would not be able to get their life-saving medication without Maine Care. I have patients, even with Maine Care, they are struggling with their bills, with their jobs. A lot of these patients are working and are trying hard to work, and a lot of them have disabilities and are still trying, and if you put more barriers for them to get health care, they will start getting sick. And without a doubt, I know there will be increased deaths throughout the state. Not to mention, I am not a statistics person with the legislative side of things, but there are hospitals that will start closing. Kids will not get the care they need. Without going, with HIPAA violations, I can't talk to you about exact patient cases, but people will start getting hurt. And this is something I feel very strongly about. I'll pass it back to you, Toby.
Thanks. So that's where we are here. Thank you all for being here. Do we have any questions from anyone?
Can Representative Gattine talk a little about the state budget impact if this $880 million cut from the feds comes down? How does that translate to what Maine would be looking at budget-wise?
Well, I mean, there's an awful lot of federal money, obviously, that comes in. Medicaid is basically a state-federal partnership where the state provides a certain percentage of money and then the federal government matches it. So when we talk about our budget, a lot of times we're really focused on the general fund impact. But really, when you think about what it really provides, you have to really include the federal money too. So every year, right now, in our Maine Care program, we provide about $1.3 billion in state money in order to support that. That's matched with federal money almost around 2 to 1. So, you know, there are billions of dollars every year that come in to support the healthcare needs of people. But remember, all that money, you know, that's not money that's like put in people's pockets. That's money that goes to pay hospitals and nursing homes and doctors and pay for prescriptions. It supports the employment of thousands and thousands of people across the state. So Maine Care is incredibly important from a budgetary perspective because of the health care it provides to people who are very vulnerable, but also because of the impact that it has on our state economy, especially our healthcare economy.
Can you just speak, Representative, to does the cuts that they're talking about, does it fall disproportionately on the expansion population, or is it across the board?
I mean, this is the part that's really challenging because we haven't seen the specific details yet. We've only seen this $880 billion number, which is a massive number. So you hear about things like work requirements. You hear about things like making changes in the federal match rate. You hear about things like capping the number of people that can be, or the dollars per person that can be provided. All of those things would shift costs from the federal government back over to the state. You know, if the state was in a position to provide that additional money. And as you know, we're in a sort of a tough situation this year in terms of declining revenue. So, you know, the impacts of the things that you hear being talked about would have huge general fund impact ultimately in the state of Maine.
Some Republicans have said that 400,000 number of Mainers on Maine Care is just way too much, and that there should be a look at kind of the program and getting that number down. What's your response to that?
Well, I mean, I think when you look at the number of people who are on Maine Care and what their situation is, I mean, these are people that don't otherwise have access to insurance. Again, you're talking about half of those 400,000 are children. Some of the most costly people on the program are people with disabilities who, you know, in olden days they would be warehoused in institutions, but now we found a better way to care for them in the community. Maine Care supports that. Older people who you know, use long-term care or get home supports as they age in their communities. And again, it is a tremendous support for people who need access to health care to be able to work. So, you know, the number of people on Maine Care fluctuates with the economy. You know, and you're always going to see enrollment go up and down. It went up during COVID because of, you know, concerns, you know, about the economy. It has come down since. And I think you're always going to see those types of fluctuations. But I think it's very important to support the people that are currently on the program.
I can answer that question as well. Yeah. Maine Care, as I see it with my patients, is a safety net. This is the care that when they can't make enough money, their job is not bringing in enough, they can rely on Maine Care to get health care. And if anything, actually, a lot of us in healthcare are hoping that there can be expansion. 400,000 people, you know, that's that safety net, but there are so many people who can't afford regular healthcare. Healthcare and health insurance is so unaffordable now. You know, if you go on the marketplace and try to buy something, most of my patients, you know, their eyes goes wide and say, I can't afford that. I'm already working 2 jobs trying to support, you know, a family of 4. How can I afford that? And Maine Care is what they can fall back onto right now. And so if we cut that, we are cutting the safety net of this country, of the state of Maine, and people will get hurt. And, you know, no argument for me. There is lots of, I could sit up here and complain about different things in Maine Care I don't like. You know, I'm certainly, could there reforms be made? Absolutely. But cuts is not the way to do it. We need to be going in there with a scalpel and reforming it and helping the system build it up and make it more efficient, not just slashing it indiscriminately and hurting people. It will hurt our patients.
Doctor, would you just mind pronouncing your name?
Oh, Faraci. Yep, Jessica Faraci. That's right. Absolutely.
Anything else? All right. Thank you very much.
Thank you.
Appreciate it.
Thank you, Steve.
All right.
Thank you very
Thank
much.
you so much. Yeah,
Appreciate
I'll
it.
text
You're great.
again.
Thanks.
Yeah,
We
appreciate it.
Hey, thank you.
Absolutely.
You agree? You like this? I got yours right here.
Do I autograph it for you?
Yeah, totally. That was awesome. Thank you.
Thank you.
That was
Thank you
great.
very much for
No,
asking.
thank you.
Oh, good.
That was great.
Thank you.
Nice job. Thank you so
Faraci,
much.
nice to meet you.
Yeah, I didn't really write down notes. Maybe I should have.
No, you did a great job.